name is Derek, and I'm a pharmacy student at Drake University. If you're watching this video, you probably want more information about blood glucose. In this video, you will learn why testing your blood sugar is important, what can happen if you don't test your blood sugar, and how to properly test and interpret your results.
Diabetes is increasing in prevalence, and complications of diabetes can lead to conditions such as amputation and blindness. Diabetes is actually the leading cause of blindness. Other complications include high blood pressure, heart and kidney disease, as well as complications in pregnancy and dental disease. 20.8 million people in the U.S. have diabetes, which is 7% of the population. Each year, 2.9 million people in the world die from complications of diabetes. You can prevent the complications by improving your blood glucose monitoring routine.
Good morning, my name is Lindy and I'm your pharmacist. Is there something I can help you with?
Yeah, my doctor told me I needed to start testing my blood sugar and he said that you could help me.
Okay, well why don't we just sit here for a few minutes and we'll talk about that. Why do you think your doctor wanted you to test your blood sugar?
He wants me to monitor it to see how well my diet is controlling my blood sugar and to see if I need diabetic medication.
Okay, well why don't we start with this meter here. This is called the Freestyle and it's very easy to use. It's one of my favorites. Some of the features of this meter are that it has a nice big display here, and it only takes 7 seconds to get your results with it.
Okay.
And it only takes 0.3 microliters of blood, which is just a tiny amount.
Okay.
It's also nice because you can download the results and track your readings on your computer.
Oh, perfect. I was looking for something like a track on my computer.
Okay. Were there any other features that you were looking for in a meter?
No, that sounds good.
Okay. All right, well let's get started with this. You have quite a few different things here that you're going to use, and so we'll set those out. The first thing you're going to do is code and use the control solution. So what you're going to do is open up a new vial of strips here and take one of the strips out and insert that into your meter just like that. Okay? The display is going to come on and it's going to give you the date and the time, and then it's going to give you a number. So right now it's saying 13. You look at your bottle and it also says 13 for the code, so you're good. Okay? If you would need to go up or down, you just use those keys. This is the control solution, and this is going to make sure your meter is working properly. You just put a little bit right there, and then bring your meter up to it, and it will insert it into the meter. Take 7 seconds to give you a result, and you will match that result up to your bottle of strips. So 104 is within the range on your bottle of strips, so your meter is ready to go. After you've tested your meter to make sure it's working, you're going to load a strip into the meter. So you just go right like this, and this will also turn your meter on. Okay. Next, you want to prepare the lancing device to prick your finger and get a drop of blood. I recommend you start on a depth of 2, and that's adjusted right here. This will prick your finger but not too deeply and give you a sufficient drop of blood. First, you're going to pull the cap off like that, and you are going to insert a needle into the device just like this. Then you are going to push down and twist as I just did, and with twisting, you are going to expose the edge of the needle. Carefully put the cap back onto the device and pull back the blue tab to make sure the device is ready to lance your finger. Then you are going to select a finger, and I suggest a non-dominant finger on maybe the side of it, like right here. You are then going to press this blue button, and you'll hear that noise, and you'll feel a slight poke as the needle pierces your skin. Set the device down in a safe place, and then bring the side of your finger with the drop of blood up to the meter, and the drop of blood will be pulled into the strip. It's going to take about 7 seconds to give you your results, and during this time you can swab your finger with a cotton ball. After you get your results from your meter, you're going to write them down and then carefully discard of the strip into the trash. You're then going to open the lancing device, and you are going to make the device vertical and press on these 2 tabs and dispose of the needle into a sharps container. Do you have a sharps container at home?
No, but I heard a milk jug is okay to use.
I would actually recommend a certified sharps container with a biohazard label. Is that okay?
Yeah, that's fine.
Okay. What questions do you have for me right now?
How often should I be testing and what times of the day?
Okay. If you're a type 1 diabetic, I would probably recommend before each meal of the day to give you a baseline reading. As a type 2 diabetic, I would probably recommend both before breakfast and before dinner to give you 2 different times of readings. A type 1 diabetic is someone who is dependent on insulin, as where a type 2 diabetic is someone who may gain control of their disease with diet and lifestyle changes. So which do you think your doctor wants you to do?
Type 2, because I'm trying to control it with diet changes, and I think I can handle 2 times a day testing.
Okay, great. Well, just to be sure that I explained everything, why don't we go through this again and you can show me how you're going to do this process.
Okay. First, I start by coating the meter with a new tube of strips and test the control solution for the first time with those testing strips. I'm going to put this on here and I'll turn it on.
And it says 13 there, which matches up with your strips, so you're good to go.
Okay. And I bring this to the side. I wait 7 seconds for the reading. And it's between the code, so I'm going to load a new strip. And get the lancing device ready.
Yep.
Place the needle in here. Twist off the cap.
Yep. Yep, and sometimes that needle will pull out, but that's okay. You can just do the same thing you just did.
This back on. Pull this back.
Yep.
And bring it to the side of my finger.
Yep.
Press this button.
Yep. You might have to pinch your finger a little bit to get a big enough drop of blood.
Okay. Then I place the drop of blood on the strip. Okay. I'm waiting for it to read.
And right at 100.
Okay. And then I take the lancing device. I discard the needle, like pinching on the lip.
Yep, and that'll be over a sharps container at home.
Okay.
All right.
Thank you.
So let's find out what those levels mean.
Okay.
All right, can you just...
The American Diabetes Association recommends blood glucose before meals to be between 90 and 130 milligrams per deciliter. 2 hours after a meal, they recommend levels below 180 milligrams per deciliter. If you are lower than 70 milligrams per deciliter before a meal, your glucose may be too low, and you may feel effects of hypoglycemia or low blood sugar. Symptoms include nervousness, sweating, hunger, pale color, racing heartbeat, and shakiness. Ask your pharmacist what to do should these symptoms occur. If your blood glucose is above 130 before a meal, or above 180 2 hours after a meal, sugars are not being well controlled by your current diet or medication regimen. This is when harmful consequences can occur from chronic high blood sugar readings.
What questions do you have for me, Lexi?
I think I understand. Thanks so much for your help today.
You're welcome.
Well, I hope this video has been informative. If you still have questions about blood sugar testing, please ask your pharmacist or visit the American Diabetes Association website at diabetes.org for more information.